One of the latest NHS staff victims of the pandemic was a pregnant nurse working at the Luton and Dunstable University Hospital. Mary Agyapong, who was 28, was said to be a highly valued and loved nurse who had been admitted to hospital last week. And doctors say her child was delivered successfully and is doing very well. Among other NHS staff who've died is Dr. Peter Tunn, a specialist at the Royal Berkshire Hospital. The total number of NHS staff who've died so far is 45. Our correspondent Andy Moore has more details.
A hospital like many across the country dealing with a surge of coronavirus patients. Luton and Dunstable University Hospital has seen dozens of deaths from COVID-19. On Sunday they lost one of their own. Mary Agyapong, also known as Mary Mo, was 28. She'd been a nurse for several years after completing her training in the UK. It's understood she'd been working during the latter stages of her pregnancy, but her NHS trust says she was not treating coronavirus patients. She tested positive on the 5th of April and she was admitted to hospital 2 days later. Her daughter was delivered by caesarean section when her condition worsened. David Carter, the chief executive of Bedfordshire Hospital's NHS Foundation Trust, said, "Mary worked here for 5 years and was a highly valued and loved member of our team, a fantastic nurse and a great example of what we stand for in this trust. Our thoughts and deepest condolences are with Mary's family and friends at this sad time." A fundraising page has been set up online for Mary's family. It describes her as a blessing to everyone she came across. It adds that her love, care and sincerity will be irreplaceable. One person who gave money said Mary's memory would live on in her beautiful baby girl. Andy Moore, BBC News.
With me is Hugh Pym, our health editor, who's with me once again. Can I ask you about the official briefing today, Hugh, about the figures? Did you detect any suggestion or hint from the government's experts that we might be heading towards some kind of improvement?
Well, Hugh, quite a lot of interest has been taken in a remark by Chris Whitty, the government's chief medical advisor, at the briefing, when he said we are probably reaching the peak overall, and he talked about a flattening of the curve. So what was he talking about? Well, one of the charts shown was for hospital patient numbers in different parts of the UK, and you can see there in London, they've come down a bit, that red line, pretty flat elsewhere, up a bit in the east of England, fairly flat in Scotland and Wales, no data available from Northern Ireland. But then he went on to say, we're not yet at the point where we can confidently and safely say that this has gone past the peak and we can start thinking about the next phase. He in fact warned that death numbers may go up in the next few days, the death toll. He talked about it bouncing back, possibly even tomorrow, because of a delay in registering deaths over the bank holiday weekend. And I think the tone from him and other government officials is they really don't want people to start thinking there's light at the end of the tunnel. They want people to realise that the peak may last for a little while, and there's no suggestion based on any of this that any of the current guidelines should be relaxed.
Hugh, once again, thanks very much. Hugh Pym there, our health editor. Well, a partnership between clinicians and university researchers and industry, which we reported on a few weeks ago, has now resulted in the production of 10,000 breathing aids for coronavirus patients who are seriously ill. This afternoon, Mercedes Formula One completed manufacture of the continuous positive airway pressure, or CPAP devices, which were designed in partnership with engineers at University College London. Initial trials suggest that they may be able to save more patients from needing the use of ventilators. Our medical correspondent Fergus Walsh has the story.
This is the stark reality of intensive care in this time of coronavirus. Royal Surrey County Hospital in Guildford has many critically ill patients on ventilators.
I just remember it being really, really difficult to breathe, and it would hurt to breathe. It's horrible. It literally scared me. I thought that was it when they were taking me away.
Tim Hall is over the worst. The 37-year-old spent 4 days on an alternative breathing device known as CPAP, which pushes oxygen under pressure into the lungs. It meant he didn't need to go on a ventilator, which requires sedation.
There you go, nice deep breath for me.
Good man.
being able to know what's going on and who's around you, and that, again, I think makes a big difference. So being awake was a massive thing.
The CPAP devices have been manufactured by Mercedes Formula One in Northamptonshire, quite a contrast to their usual job of designing engines for motor racing. They've just finished an order of 10,000 of them for the NHS. It was done in partnership with engineers at University College London, who modified and improved an existing design. The manufacturing process has been made freely available.
As a consortium, we're really dedicated to supporting the global efforts around COVID, and in response to that, we released all of the designs and manufacturing processes for the device at zero cost. Since then, we've approved over 1,300 downloads of these designs, and that's across 25 countries.
The more of these devices that are made available, the less pressure there'll be on ventilators, a limited resource which are needed for the most severely ill patients. All the medical staff on intensive care at Royal Surrey must wear full protective clothing because of the danger of infection. They know all too well the threat posed by coronavirus.
So you can see clearly the difference between the normal CT scan here and this CT scan with COVID pneumonia.
In the sickest patients, coronavirus causes severe pneumonia.
Well, what it tells us is that the lung tissue is damaged, and the damage is associated with leakage of fluid and cells into the lung, so it stops the little balloons in the lung, the alveoli, working properly. And you can see this is really quite significant. All this is abnormal tissue here.
National data shows that of more than 1,600 coronavirus patients in intensive care who finished treatment, around half have died, but an even higher number remain in critical care, their outcome still uncertain. Doctors trialling the CPAP device hope it will mean more patients will survive, like Tim, who has this message on social distancing.
And anything you think that is worth going outside for, it's not. Not when you could, as I say, potentially see your kids for that last time, or, you know, or even a week or so without them. It's hard enough. So that pint of milk, whatever it is, it's not worth it.
The CPAP machine was approved by medical regulators in just days. That's in stark contrast to several new models of ventilator, including one by Dyson, none of which have received the go-ahead for use in the NHS. Fergus, Walsh, BBC News.